Hi everyone, this is Dr. Siew. I often have young ladies coming to my clinic, distressed about the necklines that run horizontally. They often think that these necklines only recently appeared, but I have to explain to them that usually this is not the case. Today we're going to talk more about these horizontal necklines and what you can do to treat them. Horizontal or transverse necklines can occur at any age, although we tend to only notice them later in life because they do tend to get worse with age. Having horizontal necklines does not necessarily mean that you're old though. We flex and extend and turn our necks hundreds of times a day. These repeated movements give rise to the folds and creases we see on our neck, and they appear horizontally because of the flexing and extending motion of our neck. Factors such as genetics will determine whether you're more prone to these lines. If you have more fat tissue around your neck, that includes the double chin area, which is known as the submental area, and the lower neck area known as subplatysmal fat, then you are also more prone to horizontal necklines. With age, these lines do get worse because with age we lose elasticity on our skin, so the neck becomes thinner. Gravity also starts to pull our tissue downwards. Finally, as we age, we may get hyperactivity of the muscles. There is a big muscle on the neck known as the platysmal muscle, and if this has hyperactivity, it can worsen the horizontal necklines. The joke we often hear is that if you don't move your head and neck at all, then you will not have any more creases or horizontal necklines. But we know that that is not possible. So one thing we can try to do is to minimize our neck movements. One good tip is to be mindful of the way that we look at our phone. When we look at our phone, we often bend our head and look downwards, and this of course creases the neck. So in future, when you look at your phone, try to look straight ahead. Place your phone a little higher up, straight in front of you, so that you do not have to flex your neck too much when reading it. Other preventative measures will include lifestyle changes. Smoking always worsens wrinkles, so please do not smoke. Try to avoid the sun if you can, and wear a sunscreen if you go out into the sun. Good skincare is again very important, so the same skincare that you use on your face can be used on your neck. I love a combination of vitamin C and retinoids to prevent lines from forming and to treat wrinkles. The best treatment for horizontal necklines will depend on the cause. One of the most effective treatments for horizontal necklines are filler injections. Injecting a filler into the lines will obliterate and soften the creases. This, however, is a difficult procedure. Patients often complain that when they have the filler injections done into the lines, it appears bumpy. There is also a lot of bruising and downtime. The side effects of bruising and bumpiness can be minimized with experience. So please only go to a doctor who has done a lot of this procedure and is confident of doing the treatment so that you can get the best out of a filler procedure. Another treatment I commonly do for necklines are fractional lasers. Fractional lasers help to renew and resurface the skin by burning off a portion of your skin so that new skin and collagen can grow. The skin tightening effect will also improve the necklines. Our therapy helps to tighten skin and also debulk the excess tissue which contribute to the lines. So if your doctor feels that you have a very thick and bulky neck, he or she may offer our therapy as a treatment choice. Finally, botulinum toxin is another treatment that is possible. If you have hyperactivity of the platysmal muscle, then injections of botulinum toxin will help to relax these muscles and improve the appearance of your horizontal necklines. All in all, I often have to remind my patients that having horizontal necklines does not mean that you are old. It just means that there's a lot of repeated motions. Sometimes I even encourage my patients not to treat it if it doesn't affect them aesthetically too much or if it doesn't bother them. But if it does bother them, then you can consider the treatments mentioned above to help to improve the folds on your neck.